Good afternoon, everyone. I'm Dr. Kirti Soota, diabetologist at Dr. Makkar's Diabetes and Obesity Center. The topic of today's session is managing diabetes during COVID. As we all know, India is bracing for a next wave of coronavirus, as majority of its cities are seeing an increase in number of COVID cases. Mostly all cities have brought back curfews and other restrictions to halt the spread of this virus. But people with diabetes are at increased risk of serious illness from COVID 19. Understanding this risk and the best ways to mitigate it is the key to enabling patients, caregivers, and the healthcare professionals to make informed choices about the ways to manage people with diabetes during the COVID 19 pandemic. Along with general COVID 19 guidance to reduce the risk, people with diabetes have been advised to aim for good glucose control. There are chances that routine care of diabetes can be significantly disrupted during this wave also, as we have seen this thing in the last wave. Stress levels and disruptions in diet and physical activity may contribute to the worsening of glucose levels during and following the pandemic. So this session of ours is an effort of ours to help our audience manage diabetes despite of all challenges. And to guide us how to manage diabetes during this period with so many challenges, we have Dr. Makkar with us. Welcome, sir.
Thank you, Dr. Kirti. Good afternoon, everyone.
So my first question to you of the day is, how can people with diabetes reduce the risk from COVID-19?
Yes, I think it is very relevant question. And first thing we have to remember, all diabetes, people with diabetes should remember is that they are at high risk of getting COVID infections because diabetes is a condition which is associated with the decrease in immunity. Second thing is because of diabetes, people get a lot of complications. They may be having already some complications which are related to diabetes or other conditions which are commonly associated with diabetes, like high blood pressure or heart disease or kidney disease. And if they are present, they become even more prone. There is even greater risk of developing COVID infection during whenever they are exposed to COVID. So it is very important to make sure that they take all the precautions to reduce the risk of getting COVID. First thing is they should be practicing all kinds of preventive measures like regular wearing of mask. Proper mask should be there. Half the time people are wearing mask, but it is below the nose or below even the face. They are just covering the chin. So it should be properly covering the mouth and nose. They should be wearing mask whenever they are out of the house all the time religiously. They should be maintaining social distance, should be avoiding all crowded places, all kinds of gatherings. Uh, Anywhere, you will see every second day a grocery shop is or supermarket is putting up a sale, and there is a lot of crowd inside those stores. So it is better not to go to those stores for shopping. It is better to use all kind of online services that are available for procuring whatever requirements are there, rather than going to markets in these times and getting exposed. So you have to cut down the exposure maximally possible, and also make sure that your sugar levels are under control. If your sugar levels are not under control, make sure you get in touch with your treating physician. Get your treatment updated so that your glucose levels are in control range. A good control range is that your fasting should be less than 120. Your post meal, anytime after 1.5 to 2 hours after meal, should be less than 160 milligrams, and your A1C should be less than 7%. So if you're maintaining these targets, then possibly your risk of getting infections will be less. Studies have shown that if your glucose levels are uncontrolled, your chances of getting COVID infection go up by 10 times. So it is very important to maintain good glucose control. So all these measures are very important, for the patients with diabetes.
So you were talking about mask. Can you guide us? Is this cloth mask okay for this situation?
See, for routine wearing, even cloth masks are fine. But once there is the situation is worsening, like now we have very high infectivity, it is better to use a proper N95 mask. And now they are not expensive. And make sure you are wearing a good mask. And the second thing is, what people do is that same mask they will keep washing and wearing. So N95 masks are not meant for washing. They are use and throw masks, but you can use them for a longer duration rather than washing them. And if you feel that you have got exposed to a COVID patient, then you should change your mask.
So you were talking about glucose target levels in diabetics, but how can this routine care of diabetes be managed when there is this disruption in healthcare these days now? Maybe
So,
it's predicted.
so first thing is, people with the diabetes should always focus on having whatever education they know can get about their own disease. They should start educating themselves or learning about diabetes. They can do it on internet. They can always ask their treating physicians. They can always talk to the diabetes nutritionists or dietitians and get whatever possible information they need to manage their diabetes on their own. So first thing is that they should follow a good healthy lifestyle. They should be regular with their exercise or walking schedule. If you are going out for walk and you are wearing a proper mask, rest assured nothing is going to happen. If you are getting exposed in crowded areas, then it is risky. But if you are going to park for a walk where there is fresh air all around you and you are not walking in a very big group, you are walking with one or two people and you are maintaining adequate distance and wearing mask, it is good. It is not a problem that you should not be going for a walk. So maintain your regular exercise schedule. If you are scared of going out, you don't want to go out for different reasons, you continue your exercise at home. You can change the type of exercise. If you have a treadmill, you can use treadmill. You can use a static cycle to exercise. You can learn some aerobics using YouTube's videos, and you can start with the yogic exercises. You can learn dancing and do that. There are a lot of options to exercise. So you should be regular with your exercise. Second thing is, you should be having a regular healthy eating pattern. What happens is, during the confinement at home, people start experimenting with all kinds of food, and there is tendency to overeat. It is not just because you are getting good food or attractive food. It is also because you are sitting home all the time and there is nothing happening around you. So whenever you have time, you tend to eat or munch. Third thing is, sitting at home constantly and surrounded by negativity of COVID news also gives rise to some kind of low level of depression. It's a depressing environment, and that also increases the tendency towards eating more. So make sure you have a healthy eating pattern. Don't indulge in eating calorie dense foods. uh, Make sure you are exercising regularly. Keep weighing yourself regularly so that you know that you are not gaining weight. Keep checking your sugar regularly. Make sure your sugar levels are in range. So all these are the things which person with diabetes can do on one's own. They don't need any outside help to do all this. And if you are not on target, make sure you get in touch with your treating physician. I think most of the treating physicians are now available on teleconsultations or video consultations. So you don't need to be visiting the clinic or hospital. You can still get in touch with them.
So you were talking about anxiety and depression. So how to deal with this anxiety or depression like situation?
So first thing is, you have to understand that uh, it is not happening to you alone. Whether you have diabetes or you don't have diabetes, everybody is in the same boat. Now, if you are regular with your exercise, it is a good, stress buster. If you go out for a walk, it is one of the best antidepressants that I can think of. If you go out for walk, 45 minutes, 1 hour, wearing proper mask, chat with a friend, or just walk in the green environment, enjoy some fresh air, it gives you a good feeling. Second thing is you get disconnected from your routine. You get the constant environment that is there around you, you get disconnected from them. That so it gives you a good feeling. Second thing, if you are exercising, you are checking your sugars, you are maintaining your weight, that also gives you a good confidence that I am doing well with my disease part also. So I am at lower risk of getting the problem. And keep yourself busy. Keep yourself busy with work, with things that you have not been able to do because you have been going to office. Now you are sitting at home, you can do things that you have not been able to do earlier. So keep a positive mindset, keep doing things that give you happiness, pleasure, and keep your self busy to stay away from the negative feelings.
It's all within you. You have to take care of yourself. So, very, very important question amongst people with diabetes is कि I live with diabetes, I have diabetes. So, is it safe for me to work during this period?
Yes, working does not kill anybody. Only thing is you have to make sure you don't end up with unnecessary exposure. So if you are working in an office where office is still open, try to cut down your interaction with people as far as possible. Make sure whoever is coming to your table or your chamber is wearing a proper mask. Don't entertain people who are coming without mask or improper masking. Don't interact with anybody for long duration of time. Try to minimize the time of interaction that you are doing. And when you are traveling, try to travel in a if you preferably your own vehicle. If you don't have your own vehicle, try to travel by modes which can cut down your exposure. If you are working from home, absolutely no problem. You should work, actually you should work more, because now you are saving time from travel, so you can utilize that time also for working. Keep busy. If you are sitting idle, you are more likely to have problems. If you are busy, then eh, you have some consolation that during this bad time also still you are working, you are still making your doing your job, you are still earning. All these things are very positive feeling during these bad times.
So, work from home is the norm, maybe for next few days or few months. So, any important tips you would like to give to people with diabetes to take care of their good health?
So same tips, which we just discussed, that during these times you have to make sure that you maintain a regular exercise schedule, because you are sitting all the time. Then it is very important to have a good exercise schedule to compensate for the extra time that you are giving for sitting. Now, you are not traveling, you are not even going to your car. Even if you are driving your own car, you are having some kind of physical activity before and after. During driving, you are at least moving to a different side. So all these things are give you a change. Now that change is missing. So one important change is that you maintain regular physical activity. Second thing is, now if you are in office, usually what happens, somebody is coming to see you, you are going to somebody's chamber, you are interacting. Now you are not interacting with people. So make sure you keep in touch with them on social media. Third thing is, keep moving out of your chair every hour or maybe every 45 minutes. You don't need to go outside the house. Just get out of your chair, keep walking inside the house for 2-3 minutes, and you can again sit down. Whenever you are on phone calls, make sure that you are not sitting in chair or in your bed. Half the people are working sitting in bed also. It is not that you have a chair and you are working. It's better to kind of keep your working mode on. You should get up on time, go for regular exercise, get ready, get properly dressed as you go to office, and sit on a chair and table to work. So work is to be done like work. Second thing is, whenever you get opportunity, you walk inside the house only. So that keeps you active. That keeps your muscle movement active. That keeps your gives you a feeling of freshness. It doesn't make your back stiff. It doesn't make your neck stiff. It decreases your screen time. So many things, right? So these small things can help you making your work from home also better. Third thing is eating. Don't keep a bowl of popcorn or peanuts next to your work laptop or desktop. Don't try to end up eating chips. So even if you are feeling hungry in between, you want to eat something, maybe you can choose a healthier snack, or maybe choose a fruit, right? uh, Try to avoid calorie dense foods all the time. Make sure that whenever you are eating, try to control your portion size. Don't end up overeating because you have been sitting in the house or something nice is being cooked in the house. Make sure that your portion sizes are controlled. Check your body weight every morning so that you are sure you are not gaining weight. So all these things can help you in maintaining good health while you are working from home also.
You can set reminders in your mobile or your apps also.
Easy. You
For
can
a
set
moment.
100 alarms in your mobile.
Yes. For a
there
moment or a glass of
yes.
water. So my next question to you is, apart from this COVID vaccination, how do you recommend flu and pneumococcal vaccination to the patients?
So before we come to that, we were talking of alarms,
Yes.
So it is actually, those alarms are also not required. Once you start doing it, you do it for 3-4 days. After that, it becomes a habit. You start getting used to it. So it's not very difficult. Only thing is you have to have a mindset to do it. If you decide to do it, it is not a we are not trying to shoot for the stars that it cannot be done. These are simple modifications which can be done at home and should be done on regular basis. Now coming to the vaccinations, yes, I think there are I initially mentioned that diabetes is a immune compromised state. Basically, immunity is lower in diabetes individuals as compared to people who do not have diabetes. So they are at higher risk of getting infections. Not just that, because of the higher glucose levels in uncontrolled patients, then the risk goes up even further. So there are certain recommendations for regular vaccinations in adult patients with diabetes also. So these vaccinations are recommended as a routine for individuals who have diabetes as compared to normal population. And these include, one is the pneumonia vaccination. Pneumonia also, there are two types of vaccine. One is the 13-valent vaccine and the other is 23-valent vaccine. So what is recommended for adult persons with diabetes is the 23-valent vaccine, and you need to be injected only 2 doses. The first dose can be any time between 18 years to 65 years of age. Whenever you get diagnosed with diabetes, actually soon after that one should be given that vaccine, pneumococcal vaccine, which is 23 valent. Now second dose is required after the age of 65 years. So these are 2 doses that are required. Then second is the flu. They are at high risk of getting common flu. And important thing is, when diabetes persons or diabetes patients get infections, they get it more severe as compared to people who do not have diabetes. So severity is higher and risk of complications and even mortality goes up in individuals with diabetes. So it is very important to avoid getting these infections, and the best option is to prevent these. And that is why vaccinations are recommended. So second is flu. Flu should be given every year. It should be given before the season when there is usually the outbreak of flu. Like in Delhi, usually the flu starts in the months of August, September and goes through the winter period. So ideal time would be to inject that vaccine anytime between May, June to August or maybe September. But you can get it any time of the year. And it should be preferably the quadrivalent vaccine, which covers the maximum strains of flu virus. And it is to be given every year. Third is the hepatitis vaccine. Hepatitis B vaccine should be given to all the persons with diabetes. And this involves 3 doses. First dose, whenever you inject, second dose is after 1 month, third dose is after 6 months. And then, if at all, requirement is booster after 10 years. Now, with the COVID vaccination, if somebody is already vaccinated with flu, we have seen, that is our observation, that people or patients who were vaccinated with flu had lesser COVID infections. And also those who got COVID had a milder COVID infection. This, I am not saying that there is data on this. This is our observation among our own patients. Second thing is, if you have not taken flu vaccine, first preference would be to complete your vaccination with COVID. And once you are done, after maybe 3 to 4 weeks, you should get your flu vaccine also, and pneumococcal vaccine. Pneumococcal and flu vaccine can be given at the same time, but should be injected on different arms. That is more important.
So, sir, if I talk about, despite all precautions, a person with diabetes catches COVID. So, what all precautions need to be done?
So first thing is, that you have to confine yourself. You have to isolate yourself. You don't need to panic. Now, currently, what we are seeing is the very high infectivity of the virus. We are not sure whether it is all Omicron or it is Delta and Omicron, happening parallelly. But most of the cases of COVID that are getting reported are usually mild infections, but they are spreading. Infection is spreading very fast, and most of them don't require hospitalization or have major chest infection. So what you need to do is, first thing is, if you have slightest doubt, that means you have started getting fever or headache or body aches, or you have started feeling sore throat or cough or cold. The slightest symptoms, first thing, you should get yourself tested for COVID. Don't think that it is no, this is not like COVID, I can wait for another 2-3 days, it should be all right by itself. No. First thing is, you isolate yourself so that you don't spread this infection to anybody else. Keep wearing proper mask inside the house also, and keep confined to one single room. And everybody else in the house should also start wearing proper mask while in the house. Get yourself tested immediately or ASAP for the COVID test. And if your COVID test is positive, stay put at home. Supportive treatment only is required, but make sure that you connect with your treating physician, and whatever the proper treatment is required, you receive that. Second thing is, always make sure that you are checking your sugar regularly, because during any infection, the sugar levels have a tendency to go up. And if your sugar levels are going up, immediately get in touch with your physician and ask for updation of treatment so that your sugar levels are on target. Routinely measure your blood pressure also. Now you can measure at home, so you keep checking your blood pressure morning, evening. Keep checking your sugar at least 2 to 4 times every day, at least one fasting and 1 to 3 post meal values. If your sugars are high, check all post meal values and fasting every day, and immediately seek help from your treating physician to modify your treatment so that you can get controlled fast. Get treatment. Most of the cases, mild cases of COVID that we are seeing nowadays, do not need much treatment. They can be treated with only supportive medications like paracetamol, anti-allergics, cough syrup, steam and gargles and things like that. But keep a track of how your disease is progressing further. If you think you are getting more severe cough, you are starting to feel breathless, your fever is persisting for a long period. If a lot of people have purchased, pulse oximeters during this time, during the last year. If you have a pulse oximeter, just keep checking your pulse, oxygen levels also. and keep it. That also gives you a track of the pulse rate. So if your pulse rate is normal, your oxygen levels are normal, your fever is mild, you're not having much cough, your blood pressure is normal, you're not feeling much discomfort, possibly this will go off in 4 5 days time, or maybe 7 days time. But if it is persisting, then again you need to be in touch with your doctor and make sure that you are all under proper care. Now, another important thing is that getting in touch with doctor does not mean that you have to physically visit a clinic or a hospital. It is better if you have a mild infection or mild, just the glucose levels going up and down, and you're not having even infection. It's better to consult your doctor on video or teleconsult, because visiting a hospital facility or a clinic is not going to give you much advantage over and above a tele or video consult, but it will certainly expose you to more risk of infection. So I am sure, a physical consultation or talking to your doctor sitting across the table is much more, gives you much more comfort and much more confidence than what you get in a tele or video consult. But we have to, keep in mind that we have to cut down our exposure level to maximum possible. So if you have got infection, you have to make sure that you are isolated, getting treatment, keeping your sugars under control, keeping your hydration good, and keeping a check on symptoms that can indicate worsening of disease. And these symptoms include an increase in pulse rate going above 100, increase in breathlessness, worsening of cough, uh, falling oxygen saturation, and things like that.
There's a question. Can I take it?
Yes, why not?
Does COVID-induced diabetes goes with time? Can it be reversed?
There is very limited data as of now. Whether, there are two ways COVID can cause diabetes. One is the stress-induced diabetes. So stress-induced diabetes is basically it can happen during any body stress. So any infection can precipitate diabetes, any heart attack can precipitate diabetes. You can get diabetes during post-surgery, after an accident. So this is stress-induced diabetes, which will last for a while and go off. But this also means that you are prone to become diabetic during later part of, after a certain point of time, and you are more prone to get diabetes during the later part of life after that episode. You got diabetes during the stress because your body was not able to handle that stress, and your system, gave in, and your glucose levels went up. And once your stress is over, the system normalized and glucose levels came down. This is very rough explanation in layman language. Now, there is another, observation that has been reported by some studies, is that COVID virus can directly damage the pancreatic beta cells, which produce insulin. And the insulin is the key hormone which controls your blood sugar levels in normal range. So if there is damage to beta cells, there can again be diabetes, which is COVID-related diabetes. Now, if that is the situation, it is unlikely to go away, even for a while. But there is very limited data as of now. We do not know half the things very clearly. So we have to keep a wait and watch. And maybe in due course, we will be able to answer these questions more emphatically.
Another question is Omicron as dangerous as other variants for diabetic patients?
So, we basically, I mentioned during early part of this discussion that appears to be mild, but it is very highly infective. So the chances of spreading infection, if you get infection, is very high. And chances of contracting infection, if you come in touch with a person who has COVID infection, is again very high. but disease is likely to be milder, but does not mean that you cannot get complications. We are now, as the numbers are increasing, the numbers are increasing in the hospitals also, admissions are also increasing. Fortunately, we have not seen much mortality, but people who are, getting sicker are those patients who have some pre-existing condition like diabetes or heart disease. These are the people who are going to suffer more and have higher risk. So we can't take chances. Second thing is, though it appears, to be milder and very infective, what this reflects is a change in the viral behavior because of the mutations. So one thing we have seen over last 2 years is this virus mutates and the behavior is changing. Now, if it is less potent, it is milder, it is a good change in behavior. Will it change further to a milder variant, or will it become worse after second change? We don't know. So when we don't know half the things about how this virus is going to behave, we don't have clear-cut data, because every time we have learned something new comes up, and we start studying again from zero. So the knowledge about COVID is, despite n number of studies done during last 2 years, is very, very limited. And that is why we need to be cautious, despite knowing that this is a mild variant.
Any other thing which you would like to highlight on us?
I think the most important thing is that we, despite knowing that this may be a mild variant, but important thing to keep in mind that there is very high risk of getting infected, and taking more precautions is always the right way of tackling things rather than taking less precautions. So we should be as careful as we were during the last epidemic with Delta, last wave. We should not, lower our guard. We should be taking all precautions relating to social distancing, masking, sanitization, and everything. Keeping that same level of guard that was required for Delta should be followed for Omicron also. Don't take it lightly. Maybe complication rate is low, but the person who gets complications gets it 100%. So we say that maybe, one person will die in 1,000, but that person who dies is not 0.1%. That person who dies is 100%. So we don't know who gets that 100% impact. So it is always better to take all kinds of precautions.
So we would request all of you to please follow COVID appropriate behavior, follow the COVID guidelines which are issued time to time, get proper vaccinations, and follow social behavior, social distancing, masking, and sanitization techniques.
And also make sure that you are checking your glucose levels regularly, keeping your glucose levels under control, following all diet and exercise precautions, and keep a good control of diabetes. And slightest of problem, get in touch with your treating physician. Don't delay, treatment. That is most important.
Stay home, stay safe.
Yes.